Welcome. I'm Terry Cooke. You're watching Hamilton's Vital Signs, and we're together and apart in these unusual times. My guest today is Janette Smith, the still relatively new city manager of the city of Hamilton, about a year in. Janette, thanks for taking the time in what I know has to be an extraordinarily busy time in your life, but welcome to the show.
Thanks, Terry. Thanks for having me.
I always like to start with a bit of biography, and having known and worked with a whole bunch of city managers in the course of my long civic career, it's fascinating to me that while you've spent much of your career in regions not far away from Hamilton, you haven't worked here before, but you are deeply embedded in the history of this place. Tell us a bit about your family growing up and how you came to do the work you're doing.
Great. Well, I'm a born and bred Hamiltonian up on the mountain in Glanbrook. But my family history, as many have heard, goes back to the 1800s with the 5 Johns. John Dickinson was my great-great-grandfather. And my family owns a family business up in Binbrook, selling farm machinery. So been ingrained in the city of Hamilton for years. But like many of us, sometimes our university education takes us away.
Mhm.
And when you graduate, you're kind of just looking for anyone that'll hire you.
Yep.
And so the Region of Peel was the first place I applied to out of grad school, and they hired me to come work in their public health department. And I worked there for quite a few years and kind of moved my way up, director of long-term care, and eventually became the commissioner of health services. So for the Region of Peel, that's paramedics, public health, long-term care homes, and senior services. And after doing that for a few years, I went sideways and became the Commissioner of Public Works, doing water, wastewater, garbage, land use planning. And so my career goal was always a CAO or a city manager. And kind of working my way through that. And then when it was announced that Chris Murray was going to Toronto, my ears kind of twigged up, because who gets the opportunity to go back to your hometown and be the city manager?
Who says you can't come home again?
Exactly. And I applied for the job, went through the interview process, and was so excited when I was offered the job. I had my house on the market, I think a week and a half later, and sold and moved back to Hamilton the end of May of last year.
Welcome back.
Thank you.
So let me start with the obvious, which is you've had a number of different roles in different parts of a regional government, but I always say the city manager is the toughest job. The mayor of Hamilton might argue with me about that, but having been a head of a municipal council for a part of my career, I actually think that the meat and the sandwich between the bureaucracy and the elected officials is the most delicate and difficult juggling act. Talk to us about how the experience has been and how it differs from being a department head or a director within a local government.
Right. So, I mean, first and foremost, I'm overseeing all the administration and the city services. So that's a big part of my job, working with the senior leadership team, making sure we create the environment where staff can do their best work, because there's staff out there on the front lines day in and day out providing services to the city of Hamilton, now more than ever with the emergency we're in now. So that's a big part of my job. It's also a big job working with them about what policy issues we should be bringing to council. Should we be making changes to service levels? What's happening at the provincial or federal level that we should take advocacy positions? So it is our job to write those reports and bring them forward to council. And then I've worked with council. It's really important to understand what their priorities are. So about 6 months in or so, I started working with members of council about, by the end of this term, what are the priorities? And so, because we provide a lot of different services, we could be going in a lot of different directions at once. So what are those priorities that we should really move the needle or the yardstick during the term of council? So we got approval from those late last year. Kind of all, it's gone a bit crazy with COVID. So that is my job, understanding where council wants to move the yardstick for this term of council, bringing recommendations to council. Sometimes they take our advice, and sometimes they debate it and go in a different direction, which is totally fine. That is their job. Our job as staff is to bring advice. I
Democracy
do,
is the worst system in the world, except for all the others.
yeah, exactly. And I get that. I don't take it personally if council doesn't take our recommendations. If we've done our research and our evidence and our data and bring forward recommendations, we've done our job as staff.
Yeah. I want to ask you a personal question about leadership, because I grew up in a house with a grandmother who was an elected official in the 50s and 60s and 70s, in a time when women generally didn't aspire to or hold these roles. And in our city's history, you are our first. And I wonder the extent to which that weighs upon your mind in terms of all of the other things that you have to juggle. Being a first that young women, whether they're in the public service or just in the community, will inevitably think about emulating and think about in terms of their own horizon.
Mm-hmm. You know, it's funny, when I applied to the job, that wasn't even in my mind, being the first woman. It was more about my career goals as city manager, and I can do it, you know, in my own hometown.
Mm-hmm.
I think it's more kind of thought about it more now that I'm in the role. And I will say, you know, I'd forgotten that there's still barriers for women and challenges when I was over in the health portfolio, because it is very female dominated, etc. And when I took the lateral move to public works, it was a bit of a wake up call, because I experienced some things I'd never experienced before, because I was the first female in that role.
Mm-hmm.
And it was a bit of a wake up call for me. So I don't think about it, and it doesn't weigh on me on a day to day, but I've always taken it as responsibility to do mentoring for all different staff members, but particularly for women, especially after that experience in public works, about some of the challenges we still face. So it doesn't weigh on me on a day to day. Do I have some responsibility though? Absolutely. And I always felt that I have.
Want to talk about some of your experiences, because before we went on camera, you and I were comparing notes about previous emergencies, crises that we had faced in our respective careers. And it's no great secret, you're a little younger than I am, but we're in the same relative strike zone. And I know that in terms of the things that I think about in this community, I mentioned having lived through SARS, Ebola, the great plastics fire here. I was the head of council, and my observation was it brought out both the best and the worst of us. And I know you spend, and your emergency management team spend a lot of time kind of doing dry runs around what might happen. But what are the things from your professional history that you've lived through? Kind of what are the lessons taken? And then let's pivot to how is it the same or different in the present context of the pandemic?
Yeah, I think, you know, the key around good emergency response is having your emergency plan and testing it every year. And I will say Hamilton does they have a strong emergency plan and they test it. And so my experience, and when I was working at Peel, the same thing is you got to make sure you test it, because you play a different role. Your non-traditional role, you don't necessarily play it in an emergency. And if you don't test that, it's hard to switch gears in your head. We certainly had experiences with SARS. I was director of long-term care at the time. And we really had to up our game in infection prevention and control. And, you know, having personal protective equipment available to staff and have it, you know, ready to roll. After that, there was certainly a lot of lessons learned about having pandemic plans in place, about loosening up, letting our guard down a bit too fast, and it kind of spiked up again. I think it also, SARS taught us a lot about the importance of protecting the health and safety of our healthcare workers, because they were really hit hard in SARS. And I think it really updated our health and safety plans and what we needed to do to protect staff during these infection control situations. And so we started doing pandemic planning. And then when H1N1 hit, we had to dust off those plans. And it was different in that we had a vaccine but we'd never set up vaccination clinics of that scale. We set up flu assessment centers for people to go in and get assessed. And I think we had a better level of health system cooperation during H1N1 because of the learnings with SARS and protective gear and processes for our own staff. I think the difference with this one, so we had some dry run. We're setting up assessment centers now for COVID, and so we've had experience during H1N1 doing that. I think it's the scale and the duration of this that's the big lesson learned. Even with SARS and H1N1, you know, we didn't predict it would last like another 12 months or 18 months. We didn't have to implement this wide scale social distancing that we're doing now. And the scale that it's worldwide, kind of all at the same time. And so some things are the same. You have to get your emergency plan. You have to set up your emergency operations center, your logistics chief, your planning chief, all those roles, the importance of communication, the importance of kind of that quick decision making, you know, once or twice a day, assessing where you're at, looking at all the inputs, making a decision, coming back later that day or the next day and doing that whole process again and again. So some of that's the exact same thing with those other emergencies, but it's the recovery is going to be a lot longer for this, and we're not even quite sure yet when exactly that is. In fact, I think right now Premier Ford is unveiling his framework for the province of Ontario. So lots of things are the same, the scale and duration are different.
And it strikes me that the next part maybe is going to be the hardest in that, you know, there's always when there's an imminent health risk and kind of a call to action, communities generally respond well. We've seen lots of examples of, I think, positive support for neighbors and first responders and all that kind of stuff. But inevitably, the longer it goes on, both the more political it gets and the more tensions rise. And it does have the effect, in my experience, of bringing out the best and worst in communities. Talk a little bit about I know we're still in the midst of managing kind of the initial peak and stabilization on the healthcare system, but talk about the thinking that you're starting to galvanize with your team around the careful steps that will need to be taken as we try to reopen thoughtfully in this community.
Yeah, I describe it to people as it's sometimes after a short-term emergency, you can kind of flip the light switch on again and you're good to go. Mm-hmm. But this is more like a dimmer switch. And I think we're going to turn it and loosen up on some of the restrictions under the framework of the province. Mm-hmm. And we're going to have to monitor to see what's the cases looking like. Is it stable? And then turn that dimmer switch a bit more. In some ways, sometimes it doesn't pay to be first. Mm-hmm. Other countries and even some other provinces are a bit further ahead. And what we're seeing down in some of the states. So we'll be able to watch because I was doing some research on this weekend, they're all doing it a little slightly different in terms of, I think Denmark focused on opening the schools first. Mm-hmm. Others are focused on kind of more of that outdoor activity so we can get outdoors and get some more movement and feel a bit more normalcy in our lives. So I think we'll take some lessons learned from those places and see what makes sense in the provincial context. We'll flip that dimmer switch a bit and loosen up a bit, monitor the cases, and if it looks good, we'll hit the dimmer switch again. But there is a chance that we could see another spike in cases and have to turn that dimmer switch the other way. The things that'll be really important regardless until we get a vaccine or better treatment, you know, the whole social distancing, wash your hands, stay home if you're sick, probably not. If as things open, we'll still see those processes at the grocery store where we stay away from each other. They're saying some other restaurants have opened in other jurisdictions, but not at full capacity. So It's going to be slow, but you can tell everyone's getting a bit stir crazy. So if we can get the cases stabilized and we can start turning that dimmer switch, I think they get the wash your hands, stay at home, you're sick, and the social distancing. And they've risen to the challenge. And I think they respect that we can't do it all at once. But if we can loosen up a bit, I think it'll do a lot for everyone's mental health.
Hear, hear. I want to ask you a couple of social justice questions, because the two things that have emerged watching the global situation is one, that if you're lower income, vulnerable, Black, brown, Hispanic, particularly in the US, that you're dying at extraordinarily higher rates than frankly, middle or upper middle class people. And that, of course, bleeds into some of the research that we've been a part of in this town around Code Red and the social and health impacts. And then secondly, because of your background and your present responsibility for Homes for the Aged, obviously there has been a huge vulnerability exposed around seniors in congregate care. And I just would ask you to reflect upon those two things, and maybe
Yeah.
some of the things that we'll take out of this that will better position us for better outcomes for everybody in the future.
Yeah, well, I think for sure we know there's communities in PO or wards where poverty rates are at 40% relative to, single digits in other wards. And for sure, they don't have the resiliency in terms of their bank accounts, et cetera, when this types of situation happens. And, things that are happening with some of the federal subsidy, I'm really hopeful that we can get to the stage that we go back to basic income.
Mm-hmm.
Unfortunately, we had the pilot in Ontario. It was stopped, but in some ways, we're doing a big experiment of that right
Sure.
now.
Yep.
And I hope that is something that comes out of that. Maybe there's a national program and not relying on each province to look at it. And we finally move to that and bring some um, raise all the boats, so to speak. So I hope that's one of the things that comes out. I think, there's been a lot of grassroots efforts to support our most vulnerable through this. And I hope there's some really good work comes out of that as well. On the congregate setting side, it breaks my heart to see what's happening right now. As a director of long-term care who was responsible for 5 homes and have had family members, you live in close proximity. Some of these places, people share a room. So it's hard to have that social distance and infection control. And I think we've seen our hospital sector, because of practices with SARS and H1N1, they were pretty well prepared and in good shape, as long as we didn't have a spike of cases overwhelming the ICUs. But it has been those congregate settings, whether it's shelters, long-term care, retirement home, and the home care sector.
Mm-hmm.
Unfortunately, as a society, we rely on personal support workers who've been in part-time jobs without full-time pay and benefits. And they've borne the brunt of that, and ultimately the clients in those settings. So I think we're going to have to fundamentally look at how we do these congregate living arrangements and how we value and pay some of those really critical functions like personal support workers.
Last question to the present situation. Thankfully, it seems that to date, impact on City of Hamilton employees, particularly those who are serving in these extraordinarily difficult roles on the front line of a number of different things, seem to have largely avoided. We haven't had the tragedies that we've seen in major US cities, or nearly the extent. But tell me a little bit about what's going on the front line and what you've witnessed from your own staff in stepping up to meet the demands of a crisis in a community's greatest hour of need.
Mm-hmm. Honestly, they've been absolutely amazing. I was actually out of the country for the first few days that the Emergency Operations Center was activated, and then had to go into 14 days of self-isolation when I came back. And so, they just clicked into gear, just like that emergency plan and training. So the senior leadership moved into those roles of EOC director, planning, and started the emergency response. What I will say is I've been really impressed with our union leadership, who worked with us to work out how we can adapt the services to make sure the staff are safe. Because ultimately we can't take care of the community and get essential services out to the community if our staff aren't feeling safe and don't have those supports in place. HSR, has been a really challenging one because they're on the front lines too, right? Interacting with people every day. So we worked with the union to move to backdoor boarding. And, that some pieces of that worked. And then we had to, almost every day we were problem solving with them because they wanted to keep the services running for the citizens of Hamilton and the businesses of Hamilton. And, like some of our staff had to self-isolate like myself, but they couldn't wait to get back to work. People were stepping up to volunteer to be redeployed and help with screening at the long-term care homes. Can I go over and work with public health? Because the public health folks had been working on this as far back as January and getting geared up. So they've been shown great flexibility, resiliency. We practically overnight moved all our staff out of working from home, or our call center folks who are extremely busy. We're all at Wentworth. Now we're a third are at Wentworth, a third are at City Hall, and a third are working from home so we can do that social distancing. So, you talk about big governments and are kind of not nimble and they can't move quick. We can move quick when we have to, if everyone pulls together.
And I've often said that, austerity and ideology are great things. And in normal times, lots of people make the assumption that governments are the problem and not the solution. But it's amazing how quickly we realize the importance of basic services functioning and people doing these jobs in critical times like this. And I think it does shift the perspective in terms of public appreciation for the work that your people are doing. We're almost out of time, but I would be remiss if I didn't put the one hardball question to you, which is not what's going to happen coming out of this relative to my favorite project, LRT, but the fact that you took on an unusual role for a city manager, which is being part of a task force led by my buddy Tony Valeri to look at solving the province's challenge about the future of rapid transit in this community. I'm just curious about your experience there, and I'm not going to ask you to prognosticate about what your community or the council of the province are going to do with the recommendations you've tabled.
Yeah, it was interesting because I've sat on task forces before, but it was about giving input into provincial policy that's actually impacting all municipalities. And so it was very interesting. Everyone else was there was really as individuals, as Hamiltonians who want something good for the city. Yep. And I'm a Hamiltonian, so I want what's good for the city. My family's all here. But I had to, I was there as the only city rep. The council has approved things like the transportation master plan and different plans. And I wanted to make sure, and those priorities I talked about earlier, were all at that table when we were coming up with, because it's a public report now, and we were coming up with criteria on how to evaluate the different projects. That criteria was very much informed by City of Hamilton priorities and the goals of the transportation master plan. And so when we did put all the projects through, higher order transit came out number one. So, I took that role very seriously to make sure what council has approved and our goals and our priorities were at that table and could influence the outcome of the recommendations from the task force. And they're preliminary at this stage, right? It was a very short period of time. We had a lot more questions we wanted answered, but we just didn't have time to have all that further analysis done.
We'll stay tuned.
Oh, we'll stay tuned.
Unfortunately, we're out of time, but I simply wanted to say thank you for taking the time, for your leadership, to wish you well in the in the challenging time that you live in, and also to say thanks for what you're doing for my community. I appreciate it
Well,
very much, and I wish you
yeah.
well.
Thank you very much, Terry. It's my pleasure to be here, and stay safe, everyone.
Likewise. We'll see you soon.
Bye.
I'm Terry Cooke. You've been watching Hamilton Vital Signs with my guest, City Manager Janette Smith. As always, you can follow us on Facebook and Twitter. Stay safe. Look forward to seeing you again next month.